Hi, and welcome to this podcast, Better Health for Individuals. In this podcast, we'll be focusing on health promotion strategies and approaches. In this podcast, we'll be focusing on the following points. We'll be looking at lifestyle and behavioural approaches, for example, quit smoking programs and health education, preventative medical approaches such as childhood immunisation and cancer screening, and we'll be looking at public health approaches that include health promoting schools and workplaces. As a result of watching this podcast, you should be able to determine the effectiveness of a range of health promotion strategies relevant to young people. These might include government interventions relating to alcohol consumption and young drivers, as well as being able to propose other actions that may improve the health of young people. Health promotion, for example, education, social marketing, legislation and regulation, is an important part of disease prevention and can be used to help build social and physical environments that support healthy behaviours. In the past, prevention and promotion strategies such as sanitation, immunisation, quarantine, workplace health and safety, safe birthing practices, and better food and water supply have helped to prevent the spread of infectious diseases, improve maternal and child health, and create safer, healthier environments in which to live and work. According to the Australian Institute of Health and Welfare, these strategies continue to be vital today. Health promotion aims to develop settings and structures that promote and sustain health, a healthy society, improve the physical environments within which people live, learn, work and play, healthy communities, improve people's capacity to become and stay healthy, healthy individuals, reduce the number and proportion of people who are at risk of illness or premature mortality, healthy individuals, and improve the health and quality of life of people who experience disease, injury, or disability, healthy individuals. Lifestyle or behavioural approaches such as quit smoking programs and health education are concerned with individuals or groups whose behavioural or social circumstances places them at greater risk of developing unhealthy lifestyles. Approaches include an individual lifestyle approach that presumes that with appropriate support and education, individuals can change their lifestyle, but this fails to recognise the determinants for health. Lifestyle or behavioural approaches help to develop an understanding of the consequences associated with various lifestyle choices. For example, the link between a high-fat, high-salt diet and the development of cardiovascular disease, equip people with the skills to make positive health choices, develop the capacity to cope positively with change and difficult situations, and encourage people to take responsibility for their health and their actions and find personal meaning in behaviour change. Comprehensive approaches that include promotion, regulation, and increased taxation on tobacco products have contributed to the steady reduction in the daily tobacco smoking rates for people aged 14 years and over. Key risks associated with chronic disease include poor diet, physical inactivity, tobacco smoking, excessive alcohol consumption, high body mass and high blood pressure. These risks are largely preventable and can be reduced or eliminated through behavioural changes or managed with medical treatments, for example, medication for high blood pressure. Population health strategies targeting risk factors are wide-ranging, from guidelines and legislation to health programs and media campaigns, as you can see illustrated. Evaluating the impact and cost of the other community and nationwide initiatives can be difficult. Directly attributing outcomes to a specific initiative can also be a challenge, especially when multiple strategies are being applied at once. For example, legislation, taxation, and promotion campaigns, as can be seen with the various examples used to illustrate how the New South Wales government has tackled overweight and obesity. Adding to this challenge is the fact that the impact of an intervention will often be delayed, meaning evidence to support the effectiveness of prevention activities may not be available for many years. Preventative medical approaches include childhood immunisation and cancer screening. More traditional approach to illness and disease. The approaches focus on prevention and treatment of disease. Preventative measures are either primary, secondary, or tertiary actions that address individuals and populations who have identifiable illnesses, risk factors, and risk behaviours. There are three main levels of prevention involved with health promotion. The first is primary prevention, which is directed at people who are identified as being at very low risk, i.e. they show no signs of illness, and the aim is to keep them that way. Examples include nutrition education in schools to help prevent cardiovascular disease, child-proof lids, and sunscreen to prevent skin cancer. Secondary prevention, on the other hand, is directed at people who are identified at risk but have not yet developed any symptoms or illnesses. Examples include weight management for people who are overweight or obese, QUIP programs for people who smoke, and stress management courses. Tertiary preventative actions are directed at people who have suffered from a disease and need to take measures to prevent them from suffering further from that disease. For example, lifestyle and exercise classes for heart attack patients, cardiac rehabilitation, and patient education after the event. Another strategy used in health promotion is to focus on the environment rather than on individual interventions. For example, changing the physical environment, such as replacing single-lane highways with dual carriageway highways and safety glass in windows, have led to a much safer environment. Legislation and enforcement, which include the compulsory wearing of seatbelts, controlling drink driving through random breath testing, changing public policy, such as a focus on health inequality, social justice, and the determinants of health, technical interventions such as immunisation, airbags, and pollution control devices in cars, organisational interventions such as workplace health and safety committees, and the use of incentives and disincentives such as taxes on cigarettes and alcohol, lowered price of fruit and vegetables, and a lower tax on sunscreen have all resulted in an improvement in health. There are various examples of preventative medical approaches. Vaccination is one of the most successful and cost-effective population health interventions. It can protect individuals from life-threatening diseases and also reduces transmission in the community. Population-based cancer screening is an organised, systematic and integrated process of testing for signs of cancer or precancerous conditions in populations without obvious symptoms. In Australia, there are national population-based screening programs for breast, cervical and bowel cancers. They are run through partnerships between the Australian Government and state and territory governments. The programs target particular population and age groups where evidence shows screening is most effective at reducing cancer-related morbidity and mortality. Public health approaches include initiatives such as the Health Promoting Schools Initiative and Healthy Workplaces. These approaches are aimed at providing benefit for the greatest number of people. This grew out of what was known as the sanitary movement that focused on clean water, sewage and housing, and uses a settings approach to health promotion and healthcare. This movement was concerned with ensuring that plagues of infectious diseases which swept through cities and rural areas were curtailed. The huge reduction in premature morbidity and increases in life expectancy in developed countries throughout this century has had more to do with ensuring that population, both rich and poor, had access to clean water and sanitation, as it had to do with the development of highly advanced and medical technologies and medications. Public health is the organised response by society to promote and protect health and to prevent illness, injury and disability. Public health is characterised by a focus on the health of the population and groups within it, as opposed to the individual as the starting point for planning and intervention, the determinants of health and causes of disease rather than the symptoms, the promotion of health and prevention of illness and injury rather than treatment, and a focus on the public as an active partner in planning and action rather than as passive recipients of services. Settings in which health promotion can occur include schools, workplaces, healthcare settings, local communities, and consumer marketplace. Promotion can also occur at individual group level. At an individual level, promotion most often occurs in a doctor's surgery. Group-focused promotions can occur in such places as schools, workplaces, hospitals, community centres, rehabilitation clinics, or family planning centres. So how effective has health promotion been in addressing the health concerns of young Australians? Two of the biggest prevention success stories in Australia have been reductions in road deaths and tobacco smoking rates. Even though the number of registered vehicles continues to increase over time, road deaths have fallen. During that time, a number of national road safety initiatives were introduced, including compulsory wearing of seatbelts, random breath testing, and 50-km/h residential street speed limits. According to the Australian Institute of Health and Welfare, injury, including poisoning, has a major but largely preventable impact on the health of young Australians. It is a leading cause of death and hospitalisation among young people and can leave many with serious disability or long-term conditions, such as an acquired brain injury or spinal cord injury. This can severely affect their future health and well-being, as well as their employment, education, and recreational opportunities. Effects may also extend beyond the injured person, as parents may need to resume or extend their caregiving role. Young people are a vulnerable group of road users because of cognitive, attitudinal, behavioural and social factors. Globally, road traffic injuries are the leading cause of death among young people. In high-income countries, accidents in males and females account for almost a third of all those in the 10 to 24 years age group. Both globally and within Australia, young drivers are significantly overrepresented among those killed or injured in road accidents, as young drivers are more likely to engage in risky behaviours. Over the last 2 decades, there has been a large decline in the number of young people dying on Australia's roads, mainly due to initiatives such as random breath testing, compulsory seatbelts, safer vehicles and better roads. Many jurisdictions have also put in place young driver education programs, although there is no empirical evidence as yet that these programs have any effect on road crashes. Comprehensive public health policy approaches, including promotion, regulation and increased taxation on tobacco products, have contributed to the steady reduction in the daily tobacco smoking rate from 1991 to 2013 for people aged 14 years and over. This reduction has been particularly marked for younger people, with the fall in daily smoking rates over the past decade occurring predominantly among young people aged 18 years of age. The average age at which young people aged 14 to 24 smoked their first cigarette has risen steadily since 2001. In 2013, it was 15.9 years compared with 14.3 in 2001. And the proportions of secondary school students aged 12 to 17 who reported smoking in their lifetime in the past 4 weeks, past week, or the last 3 days, the last 7, continues to decline. The 2013 National Drug Strategy Household Survey has highlighted improvements in drinking patterns in Australia. The overall volume of alcohol consumed by people in Australia fell from 10.8 litres of pure alcohol per person in 2007-8 to 9.7 litres in 2013-14. This is the lowest level since 1962-63. Daily drinking is down from previous years. Between 2010 and 2013, daily drinking fell from 7.2 to 6.5% in people aged 14 years and over. Before this, the daily drinking rate had remained fairly stable at around 8% between 1993 and 2007. The proportion of people choosing to abstain from drinking alcohol rose from 20% in 2010 to 22% in 2013. This was largely influenced by an increase in young people aged 12 to 17 abstaining from 64% in 2010 to 71% in 2013. However, a considerable proportion drink to excess. In 2013, around 1 in 6 or 16% of people aged 12 or older had consumed 11 or more standard drinks on a single drinking occasion in the past 12 months, compared with 17% in 2010. Using your knowledge of health promotion, can you propose other actions that may improve the health of young people? Thank you for listening to the podcast.